Okay, looks like these are my slides. Thank you, Arthur, for the kind invitations. Thank you, Michael, and your team. It's a great pleasure to be here with you guys. And I'm going to be very practical and go straight to the bone. We will, of course, one of the questions was what were our expectations on how numbers will come back. And besides, of course, I will echo all the beliefs of this remote era and all these new ways of seeing patients, but going straight to the numbers, what I have to share with you, these are real numbers of my clinic. So, and when we see a place like where we live in Argentina, the average conversion rate of anyone getting through the clinic is not as high as other places. We have a broken economy and different conditions, local conditions, which make us very difficult to work daily. But mainly we have 23% average between 35 doctors of the clinic of conversion rate. And in a secondary feeder that we have 10%, even less. So if I take it directly to the bone and to the numbers, I know how much patients do I have to see to get back, of course, doing some assumptions and make it some easy assumptions. I know that I have to see a certain number. So taking that into account, I will be able to get back only in December or at the beginning of next year to the current numbers. So how I'm going to do this? That's the question. Can you move to next slide, because I'm not able to control it? Okay, there we go. We have different alternatives. Of course, if we are only driven by numbers, we have to be able to collect more patients. We have to be able to see more patients, and there are different strategies that I'm going to share with that. And the second one, and very important, and perhaps this is strongly related to Vivior, we need to be more efficient. We need to have a higher conversion rate and work in our people. So currently what we are doing is we are training every week very personalized lessons of skills, of sales, and even of scientific talks to each doctor of the clinic to strengthen their weaknesses. There we are truly focusing in our people now that we have more time. And of course, there are other interests that I have, that is IP, and I consider now more important than ever to have agile structures and low fixed costs. So everything that you can clean we have to remove all the fat and become very, very slim and very agile. Can you go to the next one, please? So if we go to the numbers, and this is something very interesting, these are the conversion rates of each doctor of the clinic in each technique. And just to put you an example, we have ranges from 50% of the guys that are converting more patients of ICL to other doctors that are only converting 7% of the patients that are willing to do a procedure. So we have a huge gap between where we can become more effective. And there's this is the kind of analysis that we have to be doing today in our clinics. Is okay, we need again to have people inside, but how are we going to become more effective? How are we becoming more attractive to people to go to a surgery that we believe that is going to improve their lives? With trifocals directly directed with Vivior, we have guys, and happens to be myself there, that we have a disparity with 14% of other doctors from my clinic, that they are specialized in refractive surgery, that they have similar backgrounds. Why some people are convincing much more than others? So there's where we are focusing again to try to become closer here. Next, please. Next. So we are currently doing this. We have been doing this for the last 2 years, and we are doing this more than ever. Whoever gets in the clinic, we cannot lose them. We have to survive. So we are customizing our agenda, depending in all those charts that you have seen, to see who's the best surgeon to try to convert each procedure. And it happens that there are discrepancies between procedures, age, gender. There are doctors that are better with certain ages, others that are more effective. So whenever you start playing with your own data, you will be surprised with all the messages that you have there to become better. Next, please. So the second one is how I'm going to have more patients. I need to increase my patients. So now this has been in the pipeline for the last couple of years, but now it's a true necessity that we have. That's why we are starting very, very soon. We are closing deals in different places, but I'm launching a franchise system based on telemedicine. Please, next. Because I truly need to increase the amount of people coming from surrounding countries. These are countries, we received 12,000 patients in the last 5 years coming from other places to have surgery, which is a very, very interesting. So I'm, next please. So I'm strategically placing different feeders based in telemedicine, very low structures, very low structures with the low cost, just to have a lower entry barrier, to have the patients go there, have the main test, and be able to have the pre and the post-op from those places. So now more than ever, with the proven role of telemedicine, this I think is the way to go, and to start collecting more patients in our main hubs. This I think is the last one. So premium IOLs, I think that we can all agree that it's very important for us, and it accomplished the famous Pareto rule that it concentrates only, it's only 20% perhaps, but it's 80% of our profit. So this is very profitable for all of us, and we need to focus here. How can we become better? And here again, the word Vivior comes again. If this machine has proven to be very effective in converting more, I think it truly will have a role in our near future, because this is something that we have to focus, because this is very profitable for all of us, and it has proven that it's very important for the patient too, with high satisfaction rates. So this is where we should start focusing. I think this was my last. This is my last slide. Thank you very much.